Hi everyone, this is Professor Nicholson lecturing on Apply the Nursing Process to Patients with Problems of Sleep and Rest. Please review the following subcompetencies on your own. Sleep is characterized by altered consciousness. The body function slows and metabolism decreases 20 to 30% to conserve energy. There's also decreased motor activity and perception. People are unaware of environment and respond selectively to external stimuli. On the other hand, rest is when the body is inactive or engaged in mild activity. It results in the person feeling refreshed. It's associated with feeling a sense of calm, at ease, relaxed, free of anxiety. It's disturbed by external stimuli, and you need to know that rest without sleep is inadequate. So, in short, sleep is an unconscious state that restores the body and mind more deeply, while rest is being calm and relaxed while awake. So why do we need sleep? In short, we need sleep because it restores our body, sharpens our mind, and keeps our emotions and health in balance. The following slide shows sleep requirements throughout the lifespan. Physiology of sleep. Synchrony occurs when things happen. Work or develop at the same time is something else. Biorhythms are biological clocks that are controlled within the body and synchronized with environmental factors. Circadian rhythm is a biorhythm based on the day-night pattern in a 24-hour cycle. The circadian rhythm is regulated by a cluster of cells in the hypothalamus of the brainstem that respond to changing light levels. This affects our levels of functioning. Circadian rhythm impacts our sleep by impacting our level of functioning during a 24-hour time period. For example, we are at a higher level of functioning in the morning versus lower level of functioning at night. Sleep quality is best when an individual sleeps according to their circadian rhythm. Individuals who work night shift, change time zones frequently, or are hospitalized could lack sleep due to a disruption of their circadian rhythm. Sleep is regulated by the reticular activating system. This system is a network of interconnected neurons located in the brainstem, primarily in the midbrain, pons, and medulla. It plays a crucial role in regulating wakefulness, attention, and the sleep-wake cycle. A great way to remember the reticular activating system being the regulator of sleep is the abbreviation RAS. R for regulates, A for awareness, and S for sleep. Key functions of the reticulating activating system includes arousal and consciousness. It acts as the brain's alertness center. It keeps the cerebral cortex awake and alert and is essential for maintaining consciousness. Another key function is sleep-wake regulation. The RAS helps regulate the transition between sleep and wakefulness. Lastly, attention and focus is another key function. The RAS filters incoming sensory stimuli, allowing the brain to focus on what's truly important. For example, tuning out background noise in a busy room. Now let's dive into the stages of sleep. NREM means non-rapid eye movement. This is the restful phase of sleep where physiological function is slow. There are 3 stages involved. Each induces a further deepness of sleep as a result of the parasympathetic branch of the autonomic nervous system becoming more dominant during each stage. At this time of sleep, skeletal muscles relax. Body temperature, heart rate, respirations, and blood pressure also decrease. Next is rapid eye movement, also known as REM. This is essential for mental and emotional restoration. This is when the brain is highly active. Spontaneous waking occurs during this time. A loss of REM sleep impairs memory as well as learning. Cycling between NREM and REM sleep produces restorative rest. There are 4 states of a sleep cycle, 3 NREM and 1 REM. The sleep cycles repeat 4 to 6 times throughout the night, depending on the total amount of time sleeping. Each cycle lasts 20 to 60 minutes. The REM stage can account for 20 to 60 minutes, increasing in length with every recurring sleep cycle. For example, a new mother would definitely decrease REM sleep as she is getting up every 3 hours to feed her newborn during the night. It is highly encouraged that you review these characteristics of the sleep cycle. You may see some symptoms occur more than once. Keep that in mind. Pulse check. A nurse is teaching a group of nursing students about the importance of REM sleep. Which of the following statements should the nurse include in the teaching? Please take the time to pause the video to reflect upon each answer option. The answer here is C. REM sleep is essential for mental and emotional restoration, and loss of it can impair memory and learning. So what is the rationale? REM sleep is a critical stage of the sleep cycle where the brain is highly active. It plays a key role in mental and emotional restoration. During this stage, spontaneous waking may occur and the body experiences temporary muscle paralysis. A lack of REM sleep can negatively affect memory consolidation and learning ability. Options A and B incorrectly describe REM as a period of rest with minimal brain activity, which is more characteristic of non-REM sleep. Option D inaccurately states the timing and importance of REM sleep. I'm going to pause here and talk about how important it is as a nurse to provide periods of undisturbed sleep to patients while still providing the necessary care to the patient. For example, if a patient is scheduled to have vital signs taken at midnight, receive meds at 1 a.m. and 5 a.m., and have blood drawn at 6:30 a.m., you could give the 1 a.m. dose of medication and take the midnight vital signs at 12:30 to combine care in an appropriate manner. You should keep in mind, as you're reading these factors that affect sleep, that there are differences in each age group, as I will discuss next. Factors that affect sleep based on age. Toddlers and preschoolers tend to have trouble falling asleep, have frequent awakenings, nightmares, and tend to deal with heavy snoring at times. School-aged children and adolescents tend to have sleep disturbances due to stressors, may have excitement with difficulty falling asleep due to that, as well as be dealing with social concerns. Friends, school groups, sports, things to that matter. College students tend to stay up late due to coursework. I have a feeling a lot of you do that. They also prefer late nights, or most of them do, and then most of them have early morning commitments. Young adults work and have social commitments that can minimize sleep, and parents of young children. They tend to wake up with children in the middle of the night, and then there's also dealing with the newborn night feedings. Factors that affect sleep based on age continued. Middle-aged adults could deal with depression, anxiety, as well as tension from work and/or home life. Menopausal women could have hormonal fluctuations that cause difficulty falling and staying asleep. And lastly, older adults. Their natural hormones that control sleep decline with age. There's also sleep disturbances due to medication side effects. Factors that affect sleep based on lifestyle. So physical activity. Exercise promotes sleep if done 2 hours before bedtime. Sedentary lifestyle can contribute to falling or staying asleep. Regarding diet, a meal high in saturated fat can inhibit sleep, while foods with dietary tryptophan and adenosine, as well as carbohydrates, can induce sleep. Nicotine and caffeine. Both are central nervous system stimulants that can inhibit sleep. Alcohol. This disrupts REM sleep and may cause spontaneous wakening. And then lastly, medications. This varies on side effects, of course, and medications used to induce sleep tend to increase length of sleep but decrease the quality. Factors that affect sleep based on illness. While illness increases the need for sleep, it often causes sleep disturbances. There also could be disease symptoms that affect sleep, as well as specific disease conditions. There could also be the fear of the outcome that affects sleep, role changes that affect sleep, as well as anxiety affecting sleep. Environmental factors that affect sleep. For instance, noise can inhibit sleep, but an individual may be able to become accustomed to noise over time. For instance, the sounds of traffic. Next is light. Bright light can alter circadian rhythms. Pulse check. A nurse is preparing a teaching plan for a patient experiencing difficulty sleeping. Which of the following lifestyle factors should the nurse identify as promoting healthy sleep? Please take a moment to pause this presentation to look at the answer options. The correct answer here is C, engaging in regular physical activity during the day. Why? Regular physical activity promotes better sleep by helping the body expend energy and regulate circadian rhythms. In contrast, sedentary behavior is associated with poor sleep quality. Meals high in saturated fat, which is option A, can disrupt sleep, while caffeine, option B, and nicotine, option D, are stimulants that inhibit sleep onset and reduce sleep quality. We're now going to discuss common sleep disorders, starting with dysomnias. These are a group of primary sleep disorders that affect the amount, quality, or timing of sleep. For instance, insomnia. This is persistent problems falling and staying asleep. It is the most common sleep disorder, especially among women and older adults. Predominant complaints of dissatisfaction with sleep quality, which includes falling, maintaining, and returning to sleep, occurs at least 3 nights a week for 3 months with insomnia. Insomnia may be a side effect of medications or inadequate sleep practices. Lastly, insomnia increases the risk for depression, anxiety, as well as cardiovascular disorders. On the other hand, sleep-wake schedule disorders are caused by rapid time zone changes, shift work, or changes in total sleep time from day to day. Symptoms include decreased vigilance, reduced ability to perform psychomotor tasks, as well as short sleep disorders. Dysomnias continued. Restless leg syndrome. This is a disorder of the central nervous system that causes an uncontrollable movement of the legs while resting or right before sleep. It's common in older adults. It's treated with medications, the decrease in the use of stimulants, and activities, for instance, massage and walking. Sleep deprivation, on the other hand, is defined as the human response to prolonged sleep disturbances. Individuals have difficulty performing tasks, poor problem-solving skills, slowed reactions, and irritability. If prolonged and severe, this can cause delusions and paranoia. This weakens the body's protection against infection. Continuing on with dysomnias. Sleep apnea is a periodic interruption in breathing during sleep. It may occur several to 100 times a night and may last up to 1 minute. Oxygen levels in the blood drops and carbon dioxide rises, causing the individual to wake up. This causes hypersomnia, which is excessive sleeping, especially during the day. Snoring, on the other hand, is when the muscles at the back of the mouth relax and obstruct the airway, causing vibrations. This is more pronounced when the individual sleeps on their back. The last dysomnia I'm going to discuss is narcolepsy. This is a chronic disorder of the brain's ability to regulate sleep-wake cycles normally. It is sudden, uncontrollable urges to sleep lasting from seconds to minutes. Sleep episodes cannot be avoided, but individuals awaken easily. Individuals have an increased risk for injury if this is not properly controlled. Now let's discuss parasomnias. These are a group of sleep disorders characterized by abnormal behaviors, experiences, or physical events during sleep or during the transitions between wakefulness and sleep. For instance, sleepwalking. This occurs during NREM stage 3, usually 1 to 2 hours after falling asleep. The individual performs motor activities while asleep and is not aware and does not recall the movements. This is most common in children. However, increased safety risk is carried into adulthood. Then you have sleep talking. This occurs during NREM right before REM stage. This typically does not interfere with the individual's sleep. Parasomnia is continued. Bruxism is grinding and clenching of teeth. This occurs during NREM stage 2. This may cause dental issues. On the other hand, night terrors. This is sudden arousals in which the person is physically active and often hallucinatory. This is extremely difficult to awaken, and it occurs during NREM stage 3. Parasomnia is continued. REM sleep behavior disorders occur in REM sleep. The individual violently acts out a dream, and this may cause injury to themselves or others. Nocturnal enuresis. Please note this is different than the term nocturia. Nocturia is the condition of needing to wake up one or more times during the night to urinate. Nocturnal enuresis is bedwetting, and this is most common in children and typically outgrown. Secondary sleeping disorders could include depression, hyperthyroidism, or hypothyroidism, as well as pain. Another example is a patient with enlarged tonsils. It is important to know that this could cause sleep apnea. Again, you should know that a patient with enlarged tonsils could end up having sleep apnea. Pulse check. A nurse is educating a group of nursing students about insomnia. Which of the following statements accurately describes this condition? Please take a moment to pause this presentation to answer this question. The answer here is C. Insomnia is the most common sleep disorder characterized by dissatisfaction with sleep quality, occurring at least 3 nights a week for 3 months. Rationale: insomnia is the most prevalent sleep disorder, especially among women and older adults. It involves difficulty falling asleep, staying asleep, or returning to sleep, and it must occur at least 3 nights per week for a duration of 3 months to meet this diagnostic criteria as discussed. It can be influenced by poor sleep habits, medication side effects, or underlying conditions. Chronic insomnia increases the risk for depression, anxiety, as well as cardiovascular diseases. Options A, B, and D are incorrect because they misrepresent the prevalence, duration, and consequences of the disorder. Sleep assessment includes the patient's usual sleep pattern, their sleeping environment, bedtime routines and rituals, sleep aids, as well as sleep changes and/or problems. It's important to assess the usual sleep patterns and rituals for all patients. These are a few examples of sleep and nursing diagnoses. I highly encourage you to think of other ones as we dive a little bit deeper into our care plans. Nursing interventions promoting sleep. It is not limited to what is on this slide. It's imperative to teach your patients various techniques to promote sleep. A great example is regarding bladder fullness. This is an internal stimulus that can interfere with sleep. A goal for this problem would be to demonstrate reduction in bathroom visits during the night. Sleep hygiene is very important, even for you as nursing students. You should follow a regular routine for bedtime and waking. If you cannot fall asleep in 30 minutes, get up and do something non-stimulating. Use relaxation methods. Avoid caffeine, alcohol, tobacco, and heavy meals before sleep. Try to take a warm bath. Avoid naps during the day, and try to keep bedrooms as dark as possible. You should know to encourage exercise in the morning and daytime, not before bed. Medications to induce sleep could include non-benzodiazepines, benzodiazepines, as well as melatonin. Please note that you should always try non-pharmacological methods first, if able. Pulse check. A nurse is counseling a patient on ways to improve sleep hygiene. Which of the following patient statements indicates understanding of effective strategies to promote better sleep? I encourage you to pause this presentation and look at your answer options. The answer here is B. Taking a warm bath before bed may help me relax and fall asleep more easily. Rationale: relaxation techniques such as taking a warm bath before bed can promote sleep by helping the body wind down. I encourage you to review effective strategies to promote better sleep if you did not choose this. Option A is incorrect because lying in bed awake for too long can reinforce sleeplessness. Instead, individuals should get up and do a quiet, non-stimulating activity. Option C includes caffeine, which is a stimulant. This should be avoided. Option D is incorrect because napping during the day can interfere with nighttime sleep quality.